Maxillofacial surgery is a surgical specialty within dentistry that focuses on the reconstruction of the face, jaws, mouth, head and the neck, including procedures like facial trauma repair and dental implant replacement, among others.
Especially those with jaw tumors, cancer of the mouth, and those with fractures of the jaws, those who have been involved in road traffic accidents, especially borders. Patients usually arrive from casualty and they are sent here, and we see them in outpatients. After that, we review those who need surgery, we admit, and they are operated upon.
Sometimes others are assaults. And we also treat cases like tumors. Tumors, there are a variety of tumors. There are those ones which are malignant. It means now it has a characteristic of cancer cells. Then there are those ones which are benign. These are the ones which don't have cancer characteristics. So most common ones, we have ameloblastomas, we have ossifying fibromas, we have fibrous dysplasia, we also have dentinosus issues which are cysts, which we usually treat sometimes.
Mulago National Referral Hospital has a fully fledged ward 3B dedicated to maxillofacial patients, where they receive treatment with weekly clinic and operating theatre. Patrick Azul, a boda rider, was clobbered by unknown people using an iron bar on his head. His jaw and nose was broken multiple times, as the caretaker narrates.
Namudusa mu barracks nayo nerabanga bimusobedde. Yakwata ukwasi barua nagikolera nagituwa agamugende Mulago. Twatuukira ku casualty award. Awo twamala naku ngazi izo basawo bajja buli ssaawa baba bajja nebakukebera ne bakolako eddagala ly'okumakya n'emisana n'ekiro paka twamalawo naku zaali nga 3 ku woodi ya bakazolite, then ne batuwa transfer okujja eno ne bagamba okutungibwa kuwedde.
Azul's caretaker says according to the condition their patient was in, they never expected him to recover so quickly, and gives credit to the doctors at Mulago National Referral Hospital for the specialized care they gave him.
Mu Uganda tulina abasawo kyetwali twasuubira wabagamba omuntu w'ennyindo bw'ebanga eyasiddwa omanya nti tomusuubira kubaawo oba kuddangulu. Naye abasawo baafuba mu buli ngeri ne batukolerako eddagala eryo. Nono tuli Mulago mupya mwe tuli. Era ne wenjogerera wano mulwadde wange asobola okwetambuza, asobola okulaba gy'oli bw'oba bakusindise nti kwata ekkubo ogenda ku ddwaliro eddene e Mulago bwe waliyo obujjanjabi totya. Oyinza okutya nti ate engeri gye bali Mulago omupya bajja kulako ssente bikoze bitya, ebyo biveeko. Tambula butambuzi, ogenda kulaba abasawo bakuyiikiranga ki. Era gy'oli bwakusindika ku Mulago genda nga okimanyi nti ogenda kuzza muntu omu nga mulamu.
Timothy Mugesha, a resident of Mukono, was involved in an accident and his jaw was dislocated. He went to Mulago for a maxillofacial surgery, as he explains.
Nasooka ne ngasimanyi oba basobola okunkolako nenzija era nga kyandeese eno nazzeko operation nafuna okumenyeka muneeno n'amannyo gange gatambula sobola kuluma, so ndowooza nenfuna n'ekituli munda muneeno mulimu ekituli sobola kunywa kuba byenywa byebidda, naye nga nindiridde operation kubanga nina abalala bangi bidda bakola operation ne bakola ki ne badda nga bateredde. Era nesuubidde nti nja kudda banange mmaze okukola ki okutereera ng'abalala.
Dr. Teopista Kasande, a consultant on oral maxillofacial surgery at Mulago National Referral Hospital, notes that on average they see close to 30 patients a day, and in theatre they see 6 to 8 per week.
The challenge is Mulago Being a national referral hospital, we see very many patients. Some have been referred, others are self-referrals. So we are overwhelmed. We have many patients to see. Backlog, actually we have booked up to 2026. But we try to handle them.
The hospital says that they have the capacity to handle surgeries in the country, but more specialties in the field of maxillofacial surgery is needed.
We are so few on ground, such that our services are required so much. I am actually a pioneer. We started as 3. With 3, 2 gentlemen, Dr. Komakech works in Lacho Hospital, Dr. Chikamwes works in Naguru. I was the only female, so we were the first Ugandan trained maxillofacial surgeons. Since then, the curriculum was reviewed, and the intake is increasing with time. We started at 3, now there are more than 5.
So we urge, the only thing we need is to boost our equipment system, which the models we are using here, they are few. But we try to use the minimum we have to register success in all the cases. But the challenge we have with it also is the number of our staff, especially the maxillofacial surgeons. They are very few, limited. So the workload is only placed more in Mulago, where upcountry people have to all come, even others from international world, they all come here.
Dr. Richard Adama, a maxillofacial surgeon at Mulago National Referral Hospitals, discusses some of the most challenging cases they have handled at Mulago.
There's a case for rhabdomyosarcoma. It's a tumor of the muscles. It was on the right side of the jaw. With my senior, we had gone that time, we operated. We removed half of the jaw. And this guy, the following day, when we came, we found he was still having bleeding. So we monitored the bleeding from the morning. When it reached around in the afternoon, around 3, 4, it was intensifying. We had to go back to the theater. And we ended up finishing the theater program, up to 1 a.m. at night. So it was my first challenging case, which we did. Then the second one was also a tumor, which is called ameloblastoma. There is a lady who was referred from Jinja. It was in social media. We worked with one of our professors, Dr. Kamlegia, and the tumor had already eaten all the jaw. The whole jaw was 5 kilograms. So that tumor, now we had to remove the whole jaw down. So this lady, actually we monitored her. The following day, actually she was doing well. After a week, she was discharged.
Road traffic crashes, especially border borders, are attributed to the biggest numbers of patients being attended to at Mulago National Referral Hospital, Maxillofacial Department. Zahra Abigava, UBC News.